Today's program, okay, hang on one second, let me leave this. So today's program is the ABCs of diabetes. We're going to touch and go through the ABCs of what you should be doing to keep yourself healthy when you have diabetes. So just a little background, diabetes is obviously increasing in prevalence in the USA and worldwide. We have 34.2 million Americans that have diabetes, and 1 out of 4 don't know it because there may not be signs or symptoms of having high blood sugar levels until your blood sugar levels are pretty high, around maybe the 400, 500 range. So that's why there's a lot of people walking around out there that have diabetes and don't know it. 5 to 10% have what we call type 1 diabetes, which used to be called juvenile diabetes. 90 to 95% have type 2, which what we used to call adult onset. We don't call it adult onset anymore, only because there are children, because of the obesity problem that we have in America and worldwide, that are developing type 2 diabetes, and obviously they're not adults. It is the 7th leading cause of death in the United States. It used to be 8th. It's now up to the 7th leading cause. We have 88 million Americans out there that have pre-diabetes. And again, 9 out of 10 of those people don't know it. That's when your blood sugar levels are not within the diabetic range, but higher than they should be normally. So now we have 3 different types of diabetes. One of them is type 1, where, like I said, used to be called juvenile diabetes. It's when the insulin is no longer produced in the body. It's an autoimmune disease. Those people no longer produce insulin. They go on insulin for the rest of their lives. Type 2, again, we used to call adult onset, is that 90 to 95%. And those are the people that mainly, the problems with that risk factors are age, ethnicity, genetics. Hispanic, African, Native, and Asian Americans are more prone to developing this. Lack of exercise, being overweight, and poor eating habits. You also have gestational diabetes, is when pregnant women develop high blood sugar levels in the 3rd trimester of pregnancy. The blood sugar levels need to be controlled for the health of the baby. Once the baby is born, the gestational diabetes usually does go away, but those women that have had gestational diabetes have a 60% risk of developing type 2 diabetes in their lives. But with diet, exercise, and weight management, they decrease that risk in half to 30%. So what is diabetes? It's a chronic disease of metabolism, which in the body doesn't make enough or any insulin, as in type 1 diabetes, or they don't use, your cells don't use your insulin effectively, which is called insulin resistance. And I will go over how insulin and glucose works in your body, the pathophysiology of it, because in order to understand what you're supposed to do for your diabetes, you need to understand what happens in your body. So when you eat your food's digest into different nutrients. One of them is the sugar or the glucose. The glucose comes out of our digestive system into our blood supply and elevates our blood sugar levels. And when our glucose is elevated in our blood supply, our pancreas secretes a hormone called insulin. So the insulin comes out of the pancreas, gets into the blood supply. The insulin molecules will then pass through the blood vessel walls out to your cells, where your insulin works as a key. It unlocks the door to the cell to allow the glucose to enter the cell. Glucose is then turned into energy to be used by your body, or it's stored in your cells as fat for future use. So when we eat too much, or we have too much glucose in our body, that our body can only use so much glucose. So what happens is it's being stored as fat, and we're getting bigger and gaining weight, and that's making our cells resistant to our insulin. So what's happening is, as our cells are become resistant to that insulin, the insulin's stuck in the lock of the cell and can't open up the door to the cell to allow the glucose to enter. The glucose then stays high in your blood supply, and you start having high blood sugar levels, which is also called hyperglycemia. When you have blood sugar levels that are high over time in your blood supply, it causes a slow deterioration of your blood vessel walls. What happens is that the walls become what non-porous, and that blood supply can't get through out to the cells. So the cells can't get the energy they need to live on, and they start to die off, and your cells start to die off, your organs start, your tissues start to die off, your organs start to fail. And that's where over time, when you don't control your blood sugar levels, you can develop those diabetic complications. So it's actually a slow destruction of your blood vessel walls. Now, the blood vessels are like the tunnels that the cars go through. And if your tunnels start to collapse, you're in big trouble, unfortunately. So some of the things that can happen, chronic complications of diabetes, again, retinopathy, it's the most common cause of blindness in people of working age. The blood vessel walls of the retina are slowly destroyed. They can cause ruptures or bleeding. And again, you can develop blindness over time. Nephropathy, it's the damage of the kidneys. Again, the blood vessels in the eyes and the kidneys are very fine blood vessels, so they're very easily damaged. So you can start having issues with your kidneys. Same thing with the nerve. Nerve cells, they are fed by very fine blood vessels, so can lead to erectile dysfunction, can lead to neuropathy in your feet, developing foot ulcers if you don't check your feet. And also, not only does it destroy the microvascular vessels, the small blood vessels, but it can also slowly destroy your macrovascular vessels, which feed all your other major organs, especially your brain and your heart. And you're actually 2 to 3 times your risk of developing any cardiovascular or cerebrovascular issues. You're 2 to 3 times more at risk for developing those. So we want to reduce the risk of our diabetic complications. So you need to know your ABCs of diabetes. The first one is the A1C number, your hemoglobin A1C. It's a 3-month average of your blood sugar levels. It tells you how high and how low your blood sugar levels have been over the past 3 months. When you're eating that pasta dinner and you're not checking your blood sugar levels afterwards, you don't really have any signs or symptoms of having high blood sugar levels. Maybe you're a little bit tired, but it's at the end of the day. So this actually works on our red blood cells. Our red blood cells are floating around in our blood supply along with everything else that's in there. What's happening is when the glucose is high in our blood supply, it's actually attaching itself to the hemoglobin, which is a protein in our red blood cells. So when you have high blood sugar levels, there's more particles of glucose attaching itself to the hemoglobin in your red blood cells. So what the A1C is actually a percentage of the past 3 months of how high and how low your blood sugar levels, or the percentage of glucose that's attaching itself to the hemoglobin of your red blood cells. So that's basically what that number means. Our normal levels for someone that doesn't have diabetes, a 4.5 to 5.6%. Pre-diabetics is 5.7 to 6.4, and the American Association, I should say, to diagnose diabetes is 6.5 or above. Now, this is actually the way doctors or primary care physicians are diagnosing diabetes. It used to be the fasting blood sugar level or a random glucose of over 200 or a glucose tolerance test. But really, they're looking at, it's a look back of 3 months to see that percentage of glucose that's attaching itself to the hemoglobin in your red blood cells. That's really the true indicator of whether you do have a normal level or pre-diabetic, or you do have diabetes. Now, the American Diabetes Association suggests that diabetics keep their A1C below 7%, but the American Association of Clinical Endocrinologists are asking you to try to get that equal or below 5.6%, close to normal as possible. They feel that the closer you get it to normal is the better you're going to prevent those complications of diabetes from happening to you. Now, the only other thing is that you don't want to have a low A1C and have frequent hypoglycemia, low blood sugar reactions. Because when you have hypoglycemia, a blood sugar level below 70, for a diabetic, that actually can cause damage to your heart and your brain. So they want you to have a low A1C, but they don't want you to have the constant risk of having hypoglycemia to make that number go down. All right, so who should get it every 3 months for people that are not meeting their goals or their therapy has changed, whether you went on insulin or you changed your medication, they may check it a little bit more often, or at least twice a year for people that are meeting their goals and have good glycemic control. Most insurances pay for diabetics to get their A1C done on a 3-month basis. I don't know if you want to wait 6 months to know that your blood sugar levels are out of control. I think you should be seeing your doctor on a 3-month basis for your diabetes. Starting again with A is aspirin. Also, when you have diabetes, you have that increased risk of forming blood clots. Not everybody should be on an aspirin. That's something that you and your doctor should discuss. If you have cardiovascular risk, that may be something that your doctor does want to put you on. And usually it's a low dose baby aspirin at 81 milligrams. So that's something, again, you want to discuss with your doctor. So B is for blood pressure. Again, when you have high blood pressure, that also damages your blood vessels. So you've got not only your blood sugar level damaging your blood vessels, you've got high blood pressure damaging your blood vessels. It's very common. It affects about 60% of people with diabetes and about 1 in 3 Americans. And you can, same thing with as a diabetic, you may have high blood pressure and you may not know it. That's something that you need to be talking to your doctor about when you go to your every visit. And when you do go to your doctor's visit, 30 minutes before, you should not be, no smoking, no caffeine, no exercise. And when you do get to your doctor's office, you should actually be sitting quietly for 5 minutes in a chair with your feet on the floor, back to the back of the chair, not talking to anybody prior to getting your blood pressure taken. So that's why some doctors' offices will take it initially, but then have you sit for a few minutes and then retake it to get a true blood pressure reading. But if you do those things prior to getting to the office, you should get a pretty good accurate reading. All right. Again, I told you that uncontrolled high blood pressure can damage your blood vessels, which damage your heart, your kidneys, your eyes, anything that is fed by your blood vessels. The suggested target range for the American Diabetes Association should be below 130/80. Just keep in mind that the American Heart Association says that your blood pressure should be less than 120 over less than 80. Again, all different organizations have different goals. Depending on the type of disease that you have. You have to take the whole person into consideration. You don't want the blood pressure too low for someone that has frequent hypoglycemia also. So that's why the ADA sometimes says that should be a little bit on the higher side. So C is for cholesterol. Also want to control your cholesterol. That's a waxy substance in the bloodstream. It's important. We produce cholesterol to help build healthy cells and some hormones. So you do want to know your cholesterol level. It does, again, can affect your blood vessel walls, just like the blood pressure and your high blood sugar levels. So these are all kind of silent things that can be happening in your body that can be affecting the health of your blood vessels. So we know we have different kinds of fats in our body. We have the LDL, which is also called the lousy cholesterol, and you want that lousy cholesterol to be low. You want to have your HDL, which is your heavenly or your healthy cholesterol. That helps to move cholesterol away from the arteries. So you do want to have that high on the higher side. How do you get those lower and higher? The HDL is improved by exercise, and the LDL is improved by watching the fats in your diet, typically your animal fats. If you're looking for a fat to have, you want to go more towards an plant-based fat as opposed to an animal-based fat. So instead of putting mayonnaise on your sandwich, you might want to put a little mashed avocado. That's a healthier fat for you. But just because it's a healthier fat doesn't mean that you can have a lot of it. All fats have more calories in them. Some more calories can put more weight on you. So just because it's that nuts are a good fat for your body, you just can't have the entire bag of nuts. Triglycerides is another fat in your body, which can increase the risk of a heart attack and stroke. And triglycerides, high triglycerides, when someone comes to me and says, you know, my triglycerides are high, what can I do about it? The first thing I'm going to ask them is, how much alcohol are you drinking? Alcohol is the first thing that can elevate your triglycerides. And the next thing, if you're not drinking a lot of alcohol, you can, I ask them how much carbohydrates. Okay, so carbohydrates will turn into sugar, which eventually will put fat into your body, and that is where you're going to get your triglycerides from. So if you're not using a lot of alcohol, watch your carbohydrate intake for lowering those triglycerides. And sometimes, you know, if you're watching, you know, you're not drinking a lot of alcohol, you're really watching your carbohydrates, it can be just a family trait, so you can kind of blame your parents on that one. But that's something that you also want to get in check. Now, when you get your total cholesterol, sometimes I'll do health fairs and we'll prick people's fingers, and we'll get a high total cholesterol. So what you want to do is you want to get that broken down to see what part of that total cholesterol is high. Now, your total cholesterol is your healthy cholesterol added to your bad cholesterol, so your HDL and your LDL, and 20% of your triglycerides. So you really want to get those three things broken down to see where you're having an issue, what's elevating that total cholesterol. Sometimes your HDL is very high because you are exercising, you're eating healthy, and that healthy cholesterol is maybe in the 70 or 80s. That may be the reason why your total cholesterol is high, and that doesn't mean that that's bad. All right, so here, their ADA, American Diabetes Association suggested targets. Cholesterol, you want that to be below 200 milligrams. Oh, I'm sorry, that should say milligrams per deciliter, not MD. I just noticed that. Your LDL cholesterol should be below 100 milligrams per deciliter. And again, the healthy cholesterol, the HDL, we want that to be above 50 for men and 60 for women. And your triglycerides should be below 150 milligrams per deciliter. And again, your goal is just to lower all those things so you can reduce your cardiovascular disease, especially with people with diabetes. And you should have that done at least once a year. So I think the most important thing that you should have is diabetes education. It's a self-management. You're going to be doing this by yourself or hopefully with a family member. So you should go with your family member or your significant other for diabetes education. There are many diabetes education programs throughout Hackensack Meridian. You can go on hackensackmeridianhealth.org and put in the search diabetes management, and you can find your center that's closest to you. Insurance will, I should say, most insurance will pay for diabetes education on a yearly basis, especially if there's a different, you're having a different change, you're on insulin or you're changing your medication. It may be time for you to go and get reevaluated by a diabetes educator. You do need a prescription from your doctor that says diabetes education and the diagnosis code on it. And call up one of our centers. They can make an appointment for you. You'll sit down one-on-one with the diabetes educator and get a meal plan that's designed for you. If the meal plan is not designed for you, it's not going to fit into your lifestyle and it's not going to work. So they'll talk to you about a lot of different other things, but that meal plan is the most important thing. The algorithm for someone that has a diagnosis of diabetes, the first thing under it is lifestyle modifications, and that includes proper meal planning, exercise, and losing weight. The second thing under that is medication. And most doctors will put you on medication, especially if your blood sugar levels are high to begin with, to get those blood sugar levels down, because it's not good to have high blood sugar levels. And then they will incorporate the lifestyle modifications by sending you for diabetes education. And again, check with your insurance company. I know Medicare does pay initially 10 hours for diabetes education and 2 hours every year afterwards. So speak to your doctor about that. If it's been a long time since you've had diabetes education, this may be the time to talk to your doctor and get that going. So what they do is they have a personalized meal plan. They will talk to you about your blood sugar level monitoring, what to look for, when to do it. They can even show you how to do it if you're not sure how to do it. So that's really a big important piece of diabetes care. If you don't know what your blood sugar level is, and again, you don't have any signs or symptoms, you don't want to wait 3 months to see what your A1C is. So blood sugar level monitoring is basically a daily reminder that you have this, but you're controlling it. It can be an indicator for you that something is going on. Are you getting sick? Are you under some stress? Is your medication not working? So it can be an indicator of something like that also. So they talk about stress management, how to deal with physical and mental stress, problem solving, medications. They'll talk to you about your medications, what they do, side effects, and there's a lot more that's also involved. So I can't express how important it is to go in and get diabetes education. Again, we already talked about that. E is for eye exam. Everybody that has diabetes should go in and get a baseline eye exam. Dilating the eyes, looking at the vessels in the retina, because the diabetes, the high blood sugar levels over years can affect the small blood vessels of the retina. Those blood vessels can leak, and you can grow newer, weaker ones, and again, can damage the retina, and eventually over the years, if it's not taken care of, can cause blindness. Again, you may not have any signs or symptoms of it, and you wouldn't have any significant damage until sometimes bleeding occurred. So you want to go in and see them on at least a yearly basis. If you have an issue, they will have you come back on a maybe 3-month basis. But the idea is just get in and go get that baseline done, and then make sure that you keep up with that eye exam on an annual basis. So F is for your feet. Again, we talked about diabetes can lead to nerve damage, poor circulation. It's the #1 cause of non-traumatic lower extremity amputations. If you step on something, you may not feel it. You may have a cut, it may get affected, but if you don't have that good sensation, if you have some neuropathy going on in your feet, it may end up with an ulceration. What you need to do on a daily basis is start looking at your feet. It's just a habit to get into. Most people say, well, what am I looking for? Basically, you're looking for anything that you didn't see the day before. So it's very easy to do. When you get out of the shower, dry in between your toes really well. Take a look at the top, take a look at the bottom. If you don't see anything, that's great. But that's why it's just, like I said, a habit to get into. If you can't see the bottom of your feet, you can get one of those hair mirrors, put it down on the ground and hover your foot over it. They have those car mirrors that you could, mirrors, excuse me, on a stick that you can look underneath your car. That may be something that you can use to look at the bottom of your feet. Like I said, It's just a habit to get into. If you see something going on, you can get it taken care of. Insurance usually pays for you to see a podiatrist, especially if you can't bend down and cut your toenails properly, or if you're having some issues with some corns and calluses, and you do have diabetes, you want to have a professional to take care of your feet. Medicare actually pays every 9 weeks for you to go see the podiatrist, to get your toenails cut, to get your feet in good shape. As we get older, we can't see as well as we used to. We can't bend down like we used to. We want to make sure that we're cutting our nails properly. We're preventing ingrown toenails from happening. We're not clipping the cuticles, causing an opening where you can get an infection. So again, check with your insurance. To see how there's the picture of the car mirror that you can use. So start doing that visual inspection of your feet on a daily basis. And again, lotion goes on the top of your feet and the bottom of your feet only. Don't put any lotion in between your toes. That moisture there is a medium for bacteria and fungus to grow. And so make sure that you are getting those podiatry appointments. We talked a little bit about the glucose monitoring. It's the only thing that's going to tell you on a daily basis how your blood sugar level is doing. It can catch things before it becomes an issue. I've had patients that have their blood sugar levels have started to elevate for a day or two, and they don't understand why, because nothing has happened. But on the third day, they are having a stuffy nose and a cough. And so illness could be one of the blood sugar levels can be one of the first signs that you are getting sick. It can be, are you under some stress? So it can be an indicator for you. If you can't figure out what's going on, the idea is don't let it go. Don't let it go. That's 3 months till you go to the doctor and your A1C is high, or you're ending up in the hospital because you are sick. And you haven't controlled the blood sugar levels. And the other thing is, with illness, germs and bacteria can rapidly grow in a sugary environment. So if your blood sugar level is elevated, that's considered a sugary environment. And that's why diabetics, when they do get sick, they can get sick faster or they can stay sick longer. So the idea is when you are not feeling well, monitor those blood sugar levels. If you're not getting any better, get in to see your doctor sooner as opposed to later. So what do you learn by testing? Again, how food and activity affects your blood sugar level, how to identify and prevent low blood sugar reactions, and how well are you doing with the treatment, and decide what changes you need to make with either your diet or your exercise. More frequent monitoring if you are ill, under a lot of stress, if you've had a change in your diet, your exercise, your medication. Those are the times that you might want to test a little bit more frequently. People will say, well, how often should I test? That's up to you and your doctor to discuss. The ADA guidelines are if you're not taking medications, it's once a day. If you're on medications, it's twice a day. If you're on insulin, it's 3 or more times a day. Those are the guidelines. That once a day. So when do I test that once a day? A lot of doctors will say, well, test first thing in the morning. The best times to actually test once a day are to vary the times, or to test once in the morning and the next day, 2 hours after your biggest meal. That's probably when you're going to find the biggest change in your blood sugar levels, first thing in the morning and 2 hours after your biggest meal. So you can test once a day for 6 different days and get 6 different results, but you know a lot more about what your blood sugar level is doing. So if you test one day before breakfast, one day before lunch, one day before dinner, the next day 2 hours after breakfast, 2 hours after lunch, 2 hours after dinner, that's 6 different times that you've tested just once a day, but you know a little bit more about what's going on throughout the day. What are you looking for? The guidelines for American Diabetes Association are for fasting or before meal. You're looking for your meter to be anywhere between 80 to 130. 2 hours after your meal should be less than 180, because your blood sugar level is going to rise 2 hours after you eat. So it is going to be higher. But they do want that to be less than that 180. And again, those are things that you need to discuss with your doctor, or you can just discuss with your diabetic educator when you go for education. H is for health maintenance. This is so important now that we have this whole COVID issue going on. Should you get vaccinated? Vaccinations are going to help to prevent you from getting sick, because again, like I said before, when you do get ill, just the stress of being ill can elevate your blood sugar levels. And then whatever is making you feel ill, or whatever germ or bacteria is in there that can rapidly multiply. So like I said, when you do get sick, your blood sugar levels go elevate, and then the germ or bacteria that's in there is rapidly growing. So you're getting sicker faster, or you're staying sicker longer. So you need to see the doctor sooner than later. So that's why you want to protect yourselves from the flu. You should get pneumococcal pneumonia, the Pneumovax vaccine. There are the COVID vaccine. Let's see, what else? Shingles, if your doctor recommends that. Also, you do really want to protect yourself from these diseases. Annually, you should get your flu vaccine, excuse me. If you had your Pneumovax vaccine before you're 65, you do need to get a booster. If the previous one was 5 years before that. So I is for identifying special medical needs. We know that diabetes can lead to complications, and sometimes we need a specialist. The specialists that you may be seeing are the endocrinologist, which is a doctor that deals specifically with the endocrine system. The endocrine system consists of all your glands. So they are and your pancreas is a gland. Anything that secretes a hormone is a gland. So your thyroid, your pituitary, your adrenals, your pancreas, those are part of the endocrine system, and they are the specialists for your diabetes. Now you want to make sure that all your hormones are where they should be. A lot of people maybe have a thyroid issue, now they have diabetes. You want to make sure that all those hormones are balanced, so that may be the time that you want to see an endocrinologist. An ophthalmologist is these eye specialist, a medical eye doctor. You're seeing an optician or an optometrist, and there's some issue that's going on with your eyes, they're going to send you to a medical eye doctor, which is your ophthalmologist. So if you are not seeing an ophthalmologist, I would just suggest that you go to see one and stick with that ophthalmologist. Because the diabetes can affect our blood vessels, which can affect our circulation, affect our heart, you may want to see a cardiologist. A nephrologist is a kidney specialist. Again, if it's affecting the blood vessels of the kidneys and you're having some issues with your kidneys, that would be the specialist that you want to see. And again, the podiatrist is your foot doctor. K is for kidney disease. Again, when you have high blood pressure and high blood sugar levels with diabetes, that can lead to some kidney disease or kidney failure. You should make sure that your doctor is doing urine for microalbumin at least on a yearly basis. Most doctors, I believe the guidelines for after 5 years or some protein in your urine, they might suggest that you have a 24-hour urine done. That is where you just collect your urine in a jug for 24 hours, and then you send that into the lab. What happens is if your kidneys are damaged, or if they're stressed, they're working overtime because they're trying to get rid of the glucose that's high in your system, you may start to see some microalbumin or some protein in your urine. When you get the blood sugar levels under control, that usually does go away, but if it does not, that may mean that you are having some permanent damage to your kidneys. So that the microalbumin or protein should be checked in your urine at least on a yearly basis. Again, keeping the blood sugar levels under control, keeping your blood pressure under control can decrease that risk of kidney damage. All right, so staying healthy is part of staying safe. The hospitals and the physicians' offices are open during the COVID-19, and so please don't hesitate to see in-person personal care. And on the staff at Hackensack Meridian Health have had enhanced processes to protect the safety of the patients, the staff, the physicians. They're monitoring temperatures. We're doing rigorous cleaning and sanitizing and more. So you can get those details at hackensackmeridianhealth.com/getcareNow. I also just want to talk a little bit about meal planning. Most people come on here looking for, what do I eat? I just want to go over some basic meal planning principles. You, as a diabetic, you should be eating 3 meals a day, no more than 4 to 5 hours apart. Sometimes you'll have a snack before you go to bed. If your blood sugar level is low and you're checking your blood sugar level before that, they may suggest that you have a snack. But more importantly is that you want to combine your foods, your proteins, your fats, and your carbohydrates. They all need to be combined properly. That's why you need to get that meal plan designed for you. So your carbohydrates are your foods that turn into sugar. Your breads, your pasta, your potatoes, your rice, corn, peas, beans, lima beans, kidney beans, black beans. They have protein in it, but they also have carbohydrates. So those things are going to turn into sugar in your body. Your body needs carbohydrates. It just needs a certain amount of carbohydrates at each meal, and a certain amount percentage a day based on your height and the weight that you're supposed to be. That's why it's important to go talk to somebody to get that meal plan. So what you do is you take that certain amount of carbohydrates at your meals and you pair them with your proteins and fats. Because what happens is your proteins and fats will slow down the digestion of your carbohydrates, slow down the release of the glucose into your blood supply. So instead of eating like a carbohydrate all by itself, like a piece of fruit, say you eat an apple and it rapidly raises your blood sugar level. But if you eat that apple with a tablespoon of peanut butter, that peanut butter has enough protein and fat in it that will slow down the digestion of the sugars in the apple, slow down the release of the sugar in your blood supply. So basically 1 to 2 hours after you eat your meal, your blood sugar level rises and peaks. Then within 4 to 5 hours, it goes back within a normal range and you eat your lunch. So these are things that you will learn at the diabetes management classes. So again, no skipping meals, don't eat fruit by itself, be careful with your beverages, make sure you're not drinking sugary beverages, they're just empty calories. More importantly is having a balanced meal with the right amount of proteins, fats, and carbohydrates. I'm not sure if there's anything else that somebody wants to ask. And so if you have any questions. Do we have any questions out there?
Yeah, this is Manu.
Yes.
Yes, I actually recently first time got to know from my test that I had obviously type 2 diabetes. I'm 48 years old, and that indicator you were saying, which was like 10 plus, and it's been stressful, and the gym was not there since COVID. So I kind of rejoined this weekend after the diagnosis, but obviously doctor prescribed a medicine, and I want to try this alternative route of diet and exercise.
Mhm.
Like, do you think that medicine has to be taken, or maybe I can try it and go back again as after 3 months or something as a check to see how?
Well, you know what, Manu, that this is something that you really want to discuss with your doctor. But what I can tell you is that I'm not exactly sure how high your blood sugar level are, and I don't need to know. But if your blood sugar, like I said before, if your blood sugar levels are high when you're first diagnosed, the doctor will put you on a medication. Most commonly, they'll put you on a metformin, a low dose, about 500 milligrams, which actually what metformin does, it actually helps to make your cells more sensitive to your insulin. So it lowers that insulin resistance of your cells. So it helps to make that insulin work better. If like I said before, if your blood sugar levels are high, the doctor wants you to get that blood sugar level down as soon as possible with medication. And because it's not good to have high blood sugar levels, and then incorporate that meal planning, exercise, and losing weight. Again, that is always the underlying treatment for diabetes. You definitely want to get that going, those lifestyle modifications. But sometimes you just need a little help to get that them down. That's why the doctor may put you on a medication to help along with it, because it does take a while for those lifestyle modifications to take place. So he's kind of giving you like a little jumpstart, little help to get those blood sugar levels down until you can get that foundation of meal planning, exercise, and losing weights. Because as we know, it's not an overnight process. So congratulations that you, and then once you incorporate that meal planning and those lifestyle modifications, that's another thing to revisit with your doctor. Because there are a lot of people that do control their diabetes with lifestyle modifications. But right now, he may be just giving you a little help, a little boost. So you want to revisit that with your doctor and talk to him about that. I hope that helped you. The exercise is absolutely going to be great for you. I'll talk a little bit about that. What exercise does? Exercise helps to lower the insulin resistance of your cells. So it's helping to make your cells more sensitive. So congratulations on that. When you do exercise, you should try to exercise 1 to 2 hours after a meal. Okay. If you can. If not, if you're checking your blood sugar level, make sure that you've got enough glucose in there in your body to exercise with. If it's below 100, if you're testing your blood sugar level before your exercise and it's below 100, they may want you to have just a little bit of a carbohydrate to get you through that exercise, depending on what kind of exercise you're doing. The amount of exercise is that the ADA recommends is 30 minutes, 5 days a week. Okay, and for your blood sugar levels, it's great for you to do that 30 minutes. Or 30 to 60 minutes for cardiovascular wise, but for your blood sugar levels, it's actually not how long you exercise, it's how frequently you exercise, because the exercise that you do, the effect it has on lowering the insulin resistance in your body can last 8 to 12 hours in your body. So it's not just working at the time that you're exercising, it's helping to lower the insulin resistance for 8 to 12 hours afterwards. So if you can't exercise for long periods in the beginning, you can do 10 minutes in the morning and 10 minutes in the evening until you can get up to that 30 minutes. So what you want to make sure also is that you are cleared by your doctor before you start any kind of exercise program, that he says it's okay for you to exercise. Congratulations on getting that part going, because that's a really tough piece for a lot of people, is to get that exercise piece in. But that is going to help the most with decreasing that insulin resistance and making your insulin work better that you're producing. Do you have another question for me?
If you don't mind, I can piggyback. Just answer. Basically, it looks like there is no cure, which was a little bit surprising to hear, because many times with this advancement of medical technology. So my take was that this medicine which are being prescribed, though doctor is insisting, but they are just symptomatic treatment. This is not like a treatment which is going to like bring a cure. Is that a right? Sorry.
Right. So the problem is that the risk factors for having diabetes are being overweight, not exercising, not eating properly, but age, ethnicity, and genetics are big risk factors. And there's really nothing that we can do about those three things. But we can try to take care of the other pieces by, again, losing weight and exercising. And some people say, well, you know, I lost 30 pounds and my blood sugar levels are my diabetes went away. No, you're controlling your diabetes. It just didn't go away. And it may stay without medication for many, many years. But again, we can't do anything about our age, our ethnicity, and our genetics. So as we get older, we may find that our blood sugar levels are elevating more. Because one of the other things besides insulin resistance that happens when you have type 2 diabetes is that you also can have an insulin deficiency. Now, I'm not really sure where this insulin deficiency comes from. It's that your pancreas is just not producing enough insulin. And they're thinking maybe it's genetics here, but they haven't concluded where this insulin deficiency may be coming from. So if that is part of your issue, that you're having an insulin deficiency, and you're not producing enough insulin, there's only medication that's going to help that. You do want to make sure that the insulin that you are producing is working well by lowering the insulin resistance of your cells, because what happens is if you have this insulin resistance going on and you have high blood sugar levels and the insulin comes out and gets stuck in the lock, your blood sugar levels are still high. So your pancreas is going, well, that insulin didn't work. We need more. So it's producing more insulin, but not working well. Does that make sense? So you have high insulin levels in your blood supply, but the insulin's just not working. So what happens, maybe over time, if you continue to have your pancreas producing a lot of insulin, maybe it kind of wears out. They're not really sure what's happening with this insulin resistance. But we also want to make sure that the insulin that we are producing at this moment is working well by lowering that insulin resistance. So that initial insulin that comes out opens up the lock, gets the sugar inside the cell, and lowers the blood sugar level. Does that make sense?
Thank you so much.
You're welcome. I do suggest that you do go. You are a perfect candidate to go to get diabetic education. Again, make sure that you're sitting down with a certified diabetes educator and get that individualized meal plan for yourself. Because that's really, really going to help. And don't feel overwhelmed by everything that's going on. It's going to take time for you to manage this, but just take it in small increments. Just do one or two lifestyle changes at a time. Don't completely go crazy, because you might become overwhelmed, and then that's very stressful for you, and then you have stress to deal with. So just take it one little thing at a time, and good luck to you.
Thank you.
You're welcome.
I'd like to thank Cindy for her very informative presentation on diabetes. I'm going to post this on our YouTube page for anyone who missed it, or if they want to rewatch and write down some more information. But again, I would just want to thank Cindy for being able to do this virtually via Zoom.
Thank you.
Thanks, Cindy. Could this deck be shared? This could be emailed to us.
Sorry?
This presentation could be emailed.
Well, we're going to be posting it on our YouTube page on the library homepage, so it should hopefully be up there within the next few days, where you can then watch it on YouTube.
Okay.
Thank you, Cindy. Very informative as always.
Oh, thank you. Thanks for inviting me. Have a great day.
Have a great day.